This video is an overview about operating the Midmark Dental LED light, including turning the light on and off, using the CureSafe setting, adjusting the light intensity, and positioning the light ergonomically. Always refer to the appropriate technical documentation for the complete list of instructions, safety alerts, and sequence of procedures before conducting any service or maintenance operations. The Midmark Dental LED light gives you complete control with an ergonomic 3-axis design for pull, tilt, and twist mobility, 350 degrees of rotation, and easy access to the touchpads on either side of the light. Turning the light on and off. Your LED light uses an automatic motion-controlled on and off function. A light will turn on when you lower the flex arm slightly below the neutral position and turn off when you raise it above the neutral position. To change the angle for the auto-on function, position the flex arm at the desired angle. Then press the power button for 3 seconds. The light will beep once to indicate the new angle has been programmed. You can also press the top power button on the left or right side touchpad to turn the light on or off. The light will maintain auto on or off functionality with further movement. For example, if you press the power button when the light is off, the light will turn on. Then, if you move the light downward, it will remain on. If you raise the light above the neutral position, it will turn off automatically. Using the CureSafe setting. The Midmark LED light is equipped with a CureSafe setting to deliver illumination without the normal intensity that can prematurely cure composite materials. To use the CureSafe setting, press the middle button on the left or right side touchpad. To exit the CureSafe setting, press the same button again. Turning off the light entirely also exits the CureSafe setting. Adjusting the light intensity. The Midmark LED light offers 3 light intensities: high, medium, and low. To adjust the intensity, press the bottom button on either the left or right side touchpad. Keep pressing and releasing the button to cycle through the levels until you reach the desired intensity. The selected intensity remains unchanged until it is adjusted again using either bottom button. Turning the light off does not reset the intensity. When turned back on, it will be at the same intensity level set before it was turned off. Positioning the light ergonomically. Proper ergonomic positioning of your light can help reduce shadowing in the oral cavity and keep you in a neutral, supportive position. To reduce shadows, ensure the light is within 15 degrees of your line of sight. This angle will allow appropriate light to reflect when working with a mirror on the maxilla arch and sitting at the 12 o'clock position. If you are blocking the light at this angle, you are also obstructing your vision. Use it as a reminder to sit properly. If you begin to lean forward and the light becomes obstructed, readjust your posture to re-expose the light. For more information about your light, refer to the Midmark Dental LED Light User Guide.